You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, this week I chat with veterinary chiropractor Michele Broadhurst about myofascial trigger points. She teaches us the difference between an active and a latent trigger point, how to distinguish them from one another, and the different ways in which we can treat them. Michele is an active member in our Small Animal Vet Rehabbers Facebook group, and I invite all of you to join us in these online communities. We have 4 groups: the Small Animal Vet Rehabbers, Hydro Vet Rehabbers, Equine Vet Rehabbers, and our Business Vet Rehabbers. You can find the links to all the groups in the description. So before we listen to what Michele had to say, first a word from our sponsors. Pulse Vet are the global leaders in veterinary shockwave technology. They manufacture the ProPulse and Versatron family of products. Now, for those of you that don't know what shockwave therapy is, it's a non-invasive, high-energy sound wave therapy that can be used on large and small animals to treat multiple soft tissue and musculoskeletal conditions. With over 20 years of clinical research, Pulse Vet is used by top veterinarians and veterinary rehab therapists to improve the quality and speed of healing, relieve pain, stimulate bone and tissue growth, and improve mobility for their patients. For more information, you can go to pulsevet.com. PulseVet will also have a virtual exhibit at the Vet Rehab Summit, so come and meet the PulseVet team at our online veterinary conference in November. And interestingly, Michele Broadhurst will also be lecturing at the Vet Rehab Summit. You guys are going to enjoy this one, especially those of you that loves facts and details. You can hear how passionate Michele is about this topic. I think we could even call her a myofascial geek. Over to Michele. Hey Michele, thank you so much for joining us.
Thanks for having me, Megan.
Michele, for the listeners out there, won't you tell them a little bit about yourself and how you got into the field of veterinary rehabilitation?
Sure. So I'm a human chiropractor by trade. So I graduated in 2003 from Durban Institute of Technology. And then I was in private practice for a while and I decided I wanted to start treating animals. So I went over to the United States and I got a degree in animal chiropractic through Options for Animals and the International Veterinary Chiropractic Association. And then I started, my practice just exploded and I had a very big, large animal practice, which specialized in horses as well as a small animal practice. And so it evolved. And then I decided to do the CCRP course, which I did through the University of Tennessee. And now I work in small animal rehab as one of their practitioners and a animal chiropractor and rehab specialist. So yeah, it's been good.
Great. So today we're going to be talking about myofascial trigger points. Now, this is something that when I was at veterinary school, I don't even think they mentioned the word. So it's not something that we learn about. And, you know, we don't learn at veterinary school about anything muscular. You know, I don't even remember even being taught about palpating muscles. You know, it was really always just in the examination, mainly focusing on the joints, x-raying. If you can't find anything on the x-ray, then it's a soft tissue injury and anti-inflammatories and rest, you know. So like soft tissue, muscles, all those kind of things. I mean, even fascia, you know, the involvement of all these soft tissue structures in our animals and how it contributes to their pain was not something that we were taught. And it's only something that I learned after I qualified as a vet and obviously also doing the CCRP. So what exactly is a myofascial trigger point?
Okay, well, as anybody in the veterinary field, we're constantly treating myalgia. And myalgia is really muscle pain, and it comes across in many different forms. So myofascial trigger points are really interesting because it's one of the things that the veterinary world has really almost excluded completely. And I really do find over the last 17 years that this is one of the most pertinent and important things, because really we can have the most phenomenal surgery done, like for a TPLO or an IVDD, but the muscular component is so important and we often don't think about referral patterns and things like that. So and that's one of the reasons why often an animal doesn't actually do well post-surgery or even post-injury, because we're only addressing the structural stuff. We're not looking at the functional component. So having said that, basically, A myofascial trigger point occurs after there's been a breakdown or an injury to a muscle. And effectively what happens is we have an upregulation of the acetylcholine. And acetylcholine is basically, when it gets released, you normally have acetylcholinesterase, which takes that acetylcholine and gets rid of it. Now, what's happening is generally, when you have that muscle injury and it turns into a trigger point, we have an accumulation of this acetylcholine. And CGRP, which is your calcitonin gene-related peptides, and your substance P, basically, which gets released during that muscle injury, prevents this acetylcholine from being upregulated and taken away. So because of that, we develop these very fibrous bonds that mess up our sarcomeres, which is basically the way that our muscles interact. So we get these little balls of fibrous tissue, if I can kind of dumb it down to that the body prevents anything from really getting into, because it's become encapsulated. And once we get this trigger point that's been formed, we get these referred pain patterns. It actually works on a totally different system. So it processes through your actual your cerebral cortex, which is really interesting, because if we're looking at human medicine and the research that's been done there with MRIs and stimulus, especially for the brain, we find that it's in the same area. So depression, all of these things that sit in this periaqueductal gray matter in your frontal cortex, which is linked to depression, serotonin release, all those sorts of things, are actually exactly where your myofascial trigger points and your myalgia receptors go to form. So there's a huge link between chronic pain and depression and mental acuity. So it's very, very interesting when we start to look at all the research. And I mean, all of us have had dogs that come in and the owners will go, he looks depressed. And he is depressed because the way that his neurology is actually working is sitting in that prefrontal cortex. So I can geek out and give you all these very cool like receptors and all these things that happen when we start to initiate trigger points, but that's probably for another day. But that's pretty much what a trigger point is. And you get active trigger points, you get latent trigger points. So an active trigger point is basically something that has a referred pain pattern. You get a local twitch response, which is basically when there's a dysregulation in the motor end plate. So basically we're not getting that connection. So whenever we're identifying an active trigger point, you very often get a jump sign from the patient and a twitch response from that local twitch response. And that's how we actually identify it as an active trigger point. Latent trigger points can become active. And that's what we often forget. So we're so busy treating active trigger points that this poor little latent guy is upregulating with his acetylcholine and all this stuff, and he actually switches over to become active. And all of a sudden now we've got another pain response.
So would a latent trigger point be an active one that wasn't treated? So does
Not
it go active in? Okay.
Not necessarily so. So basically an active trigger point is one that actually has a referred pain. So that is something that, let's say we've got a trigger point in the bicep and it's actually going to go down towards the elbow. And the pain that they're feeling is not necessarily in the trigger point itself. It actually is manifesting in the elbow. Latent trigger points don't have that. So they very often, with acute injury, active trigger points form very quickly. With something like osteoarthritis, where you're getting that low level contraction all the time, and we're getting the Cinderella theory, which is basically where you're constantly having the same muscles being used all the time, and the fat sisters aren't coming to the party to help out. So it's just poor old Cinderella cleaning up after a big do. So that's the way that I really look at it. So we've got these poor little low contractile fibers, and then they become latent often, or they can become active. But it's really important to treat both, because those latent trigger points can transfer over into active trigger points.
Yeah, and that sort of active trigger point, when you talk about that referral pain, it's that type of pain where, you know, if you've got like you do a certain movement and then suddenly you get a pain, and then someone says like, where is it? And you can't actually work out where it is. That's what you're talking about.
100%. So it can be very sharp, but for the most part, it's almost like a diffuse toothache, deep,
Yeah.
kind of a little bit deeper kind of organic pain
Yeah.
that manifests. And so, for example, like with TPLOs, that's a great example, because a lot of the time we immediately get almost like a disuse atrophy. And because of the amount of recovery and the amount of joint trauma, which is absolutely necessary, those muscles go through a inhibition loop. So we're getting that negative feedback all the time where the body doesn't want to use that limb. So when we do start to use it, by activating and getting those muscle fibers to actually work correctly, a lot of the time they fatigue very fast. And because then we start to get a low level of injury, we start to get those myofascial trigger points. And if I always explain it to clients that it's almost like an elastic band. You've got this beautiful elastic band that has so much integrity. Now you snap that band and you try to put it back together, right? And you put a knot in, and then that fails. And then you put a knot in and that fails. And eventually you've got this very knotted elastic band that doesn't have the integrity that it had before. So we cannot recruit the muscle fibers correctly when we're getting this constant feedback and negative feedback with the body trying to protect itself. And we end up with all these trigger points which do not allow the muscle to actually form correctly and function correctly, because it's kind of at half-mast all the time, because it's being constantly, the integrity of the muscle is being compromised all the time.
Yeah, and the contractibility of that muscle is impaired.
Absolutely.
Because of that. So would we find these trigger points in muscles that are being overused?
Yes, so it is definitely in acute injury as well as chronic and overuse syndromes. And I find that is something that we ignore a lot. I mean, I could go on for hours about this because I'm incredibly passionate about it. But, and fascia, we don't even ever really, up until very recently, have we even considered the fascial system. And what people need to realize is if you actually took all the muscle and away from the body, that fascial system could keep it in place. I mean, how amazing is that? Now, if that's not working correctly and it's not performing at a high level to, give nourishment to the muscles and give structure and all of that, if we're having the elastic band theory there, we're really compromising our structure. So fascia is as important as muscle, and that's why it's really myofascial, because it does cover both. It's not just, let's just treat that muscle.
Yeah. So these trigger points, though, although we say myofascial trigger points, the trigger point itself is actually in the muscle.
Not necessarily.
Okay, so it could be in the fascia.
Absolutely. And we find a ton of trigger points in the fascia. And a lot of the time we actually miss it if we're using a needle, because we always go too deep. But it's very interesting. And, if you're looking at myofascial release and evaluating fascia correctly, and, that's where you learn all your skin rolling techniques and all that sort of thing. It's really designed to allow the body to function in a plane system correctly. So when you have fascial trigger points, you're actually getting little speed bumps in the mobility of the fascia itself and in the mobility of the structure within whatever you're treating. So yes, it's absolutely found in the fascia itself.
Okay. And so these trigger points, how do they contribute to pain in our patients?
Well, so
big question.
Big question with lots of answers. So the biggest thing is, and I'm not going to go into way detail because it can get really confusing, but really what happens is you're dealing with C fibers, you're dealing with calcium pumps and ionic uptakes and things like that. So when the muscles aren't functioning correctly, with the referred pain and things like that, one, we're getting a structural inhibition because we're not getting that muscle to actually work correctly. So when we're not getting full contractibility of the muscle and relaxation, because you've got to remember with ATP too, that's how that muscle fiber actually works. So it's predominantly an acetylcholine uptake. And then we actually need the ATP, which we always think is needed for contractibility, but we forget that it's really needed for relaxation at the same time. So if we can't get those sarcomeres and those motor end plates to relax and start to function correctly, we're going to constantly have this kind of overpowering influx of this, almost like the referred, we'll call it referred pain, but it really is very deep and very neural almost. So what the body does very cleverly is it creates that negative feedback loop. So the more you don't use it, the more the body doesn't want to use it. So when we have those trigger points and they're referring pain, and they refer it on in dynamic and in static positions, so it's not always on movement. So it's very difficult to gauge where it's coming from, is, a lot of the time, until you get your skills up. So by having that referred pain all the time or periodically, it inhibits those pain receptors on a constant level. So we're constantly overloading those pain receptors to the point where then we change gait and biomechanics to accommodate for that. And by keeping that limb or that muscle in a contracted or an elongated position for too long a period of time, we're not getting the blood flow we need. We actually end up with a completely different gait or posture than we had before. And then that in itself creates its own loop, which creates pain. So that's why I say it's not as easy as like, oh, this is how it works. And in addition to that, we're dealing with a lot of osteoarthritic dogs or joint dysfunction dogs, which has a completely different pain mechanism. So when we're looking at pain on any sort of level, we've got to take into account that it's multifactorial. It's never just a joint and a fusion and pain from that, and because the articular cartilage is breaking down, and there's always a compensatory mechanism. And this is what I try to explain to a lot of people, is like, you need to realize that when your muscles are going into spasm, what is it protecting? And if we can treat that underlying cause, and we always start with pain, getting rid of pain and inflammation, because we all know the biofeedback mechanisms because of that. And if we don't get rid of that first in order to progress, we're just never going to get to that end result.
Yeah, so like if we have a case, let's say that's an osteoarthritic case that has a lot of trigger points, and we're not addressing those trigger points, and at the same time we're trying to strengthen them because they've got muscle wastage, we're not really getting anywhere. We're just taking 2 steps backwards because of that inhibition. So we need to be addressing those. We need to be addressing the origin of that pain.
Correct.
Potentially coming from there.
Absolutely. And I think the biggest trouble is in veterinary medicine, in 4 years or 6 years, depending on the length of your course, you have so much to learn. You never really can get to that level where you understand the myofascial system completely. Well, nobody ever understands it completely, but have a good knowledge of it, because it's very difficult. And it's very, very involved. And, when you start looking at receptors and the way that the body actually integrates and how things work, it does get very tricky. So, using this as a tool is fantastic, because you can really have a look at not just the structural stuff that you're dealing with, but the functionality too. And the two really are very well married, because if you take one away, you're only going to get half the results. So if you're strengthening something in the incorrect position, all we're doing is exacerbating the initial problem. Because let's take a dog that externally rotates its foot, as we see in its hip dysplasia. Okay, so they're trying to take the pressure off that femoral head at the acetabular insertion. That's inflamed. We've got a little bit of effusion going on around that joint. But what happens? Glute medius starts to engage. Iliopsoas starts to compensate. Sartorius gets really, really tight, to name a few. Now, are we looking at those muscles? Okay, we give it a little massage and we're like, okay, let's go do therapeutic exercises. But we're not actually getting that feedback loop. So until we're actually getting a positive feedback where that muscle can engage, activate, and strengthen in the correct position, we're just trying to put knots into our elastic band.
Yeah, and also those muscles, obviously, they're not functioning. They're not doing their job.
Correct.
If they've got those trigger points, they're just in a contracted or overworked state, and not doing what they're supposed to be doing. Yeah. So how do we treat them? So
there's a multitude of ways. I have always been a huge, I'm an acupuncturist too. So I've always been a huge fan of needles, but that's just a personal preference. And here in the US, we can't do that. But it is a wonderful way of actually getting right into that trigger point, activating that local twitch response, which really basically tells the body where to go, treat that area, break it down, reform it as normal muscle, and then we move on with our day. Now, there's a multitude of ways. You can either use acupressure, which is basically the same thing, just a little bit longer, brings a lot more blood to the area, starts to break down that scar tissue. My extracorporeal shockwave is a huge help, as is laser. It just takes quite a bit longer. I find that the shockwave is a little bit more effective as far as speed goes in breaking down a myofascial trigger point because of the angiogenesis that is created. But there's a multitude of different things that you can use. Kinesio tape is very helpful for lifting the fascia and to allow for more movement. And remembering too that you can actually do this in an exercise setting too. If they are very small, not well-established trigger points, by stretching the muscle and exercising it in particular planes, we can actually get rid of those trigger points. So there's a multitude of ways. Myofascial dry needling, for me, I just find it a huge, huge help. It's very quick. It's incredibly effective. And dogs and horses do amazingly well with it, as do people. It's a little bit more invasive, if I can say that, than the other procedures, because you're sticking a needle into a trigger point. So you do have a little bit of post-needling soreness for a day or two as that trigger point is resorbing, and we're changing the mechanics of that muscle. But there are a multitude of ways, depending on what you feel comfortable doing in your wheelhouse, that we can get rid of them. But there are amazing things coming out as far as treatment protocols. So, yeah.
So you mentioned that you're not allowed to do that now. So obviously using needles and putting them into animals depends on where you are in the world, who's allowed to do it. So can you just give us some advice about that?
So here in the US, every state and every, has its own legislation and set of rules. So it really depends on where you are. A lot of states are trying to change things and make it a lot more accessible, open up the toolbox, so to speak. Vets, vet techs, physical therapists, some chiropractors, depending on where you practice. You just need to find out whether that's in your scope of practice wherever you are. And like I say, it's not a deal breaker. There are a bunch of other things that you can utilize if you can't use a needle.
So let's just chat about when you're actually treating the trigger points. So, I mean, I have done it using sort of acupressure, and I like that way to do it initially because you can get a really good feeling of what's actually happening because you've got your finger on it, So as you find that trigger point and as you put a little bit of pressure, you get that sort of reaction, and then it seems like the trigger point actually worsens. You can just feel it going like that, and then suddenly there's just this, and then there's suddenly this release, and then your finger just goes a little bit deeper in with nothing underneath. And then you're like, yes, I did it,
That's exactly it. Yeah. And it is that simple. And it is that fast.
Yeah.
You just need to address them,
So sometimes when I've treated them, you'll find that trigger point and then you don't get that. So you just don't, using acupressure. What would be the reason for that? Are you just not on the right spot?
No, not at all. That's a latent trigger point.
Okay.
So the active trigger point is actually defined, if we can say that, by the local twitch response, which is exactly what you're talking about, which is when you put your finger on and you get that little fasciculation and that little twitch. And by definition, if you're looking at Referral and Simmons, who are the leading authority in myofascial, myofascial work, it's like our myofascial Bible in humans, that's exactly how it's defined. And the more research we do, the more correlation we find between an active trigger point and a local twitch response. Now, a latent trigger point doesn't have a twitch. And that's what the big differentiation between the two. But that's not to say that that latent trigger point isn't going to develop into an active. So it's really important to treat all of that. You just find that that active trigger point, which is giving you the local twitch response, has already got a referred pain. It's already doing its thing. That latent hasn't quite come to the party yet.
And are latent trigger points harder to treat than active ones?
No, they're the same, really. In fact, I think they're a little bit easier because they're not as acute yet. So it's very important to treat both the latent and the active. Having said that, though, there's a huge need for understanding as to referral patterns from these trigger points, and that's kind of my passion of my work, is really identifying, okay, we have a trigger point in the semimembranosus muscle. Where is that going? And dogs are amazingly responsive, because you'll see as soon as you hit a trigger point, they'll actually show you where the referral is going, by lifting a limb or taking weight off, or distribution of weight to a different area of that joint. So instead of like placing beautifully, they start loading medially or externally rotating the foot. It's very, very interesting. It's almost, once you start looking for it and you start understanding the principles behind it, you really can identify where that referred pain is going. But having said that, latents are as important because they can potentially become active.
So let's say we use a needle. How would we know when that trigger point is then relaxed? So obviously with our finger, we can feel it. How would we know that with the needle?
Well, it's very interesting because the local twitch response has always been our gold standard for knowing when a trigger point has started to release. And basically, when you stick a needle into that muscle and we start getting that twitch response, the more you activate that muscle, so the more you manipulate the needle, the less that twitch response continues. So it does take a little bit of time for it to be eradicated completely. But for the most part, once you get that super, super hard twitch, the twitches thereafter become a little bit less intense. And you don't have to do it for hours and hours and hours. It's literally a couple of seconds. I generally work on the principle to get about 3 to 5 twitches, and then I take the needle out, because then the job is done. All we are really are facilitators in healing. All of us, whether you're a veterinarian, a vet tech, a physical therapist, we are setting the body up to succeed. And the body has an innate way of doing that itself. So if we can just give it the tools by eradicating pain responses, by creating the correct biomechanics and all of that, the body really takes care of itself. And I find within 72 hours, which is generally our inflammatory protocol, it generally takes 72 hours for inflammation to dissipate. Within 72 hours, that trigger point is gone. It's super fast. So there may be a little bit of a pain response afterwards, because obviously we poked the bear. Okay. So we've taken something that's angry, made it a little bit more angry, but the end result is absolutely worth it.
So another question I have is that, in humans, you tell the person, like if I've had it ever to me, like, just keep still, and the person lies there dead still. So we don't have that. We have these moving targets. And, I having also doing acupuncture myself on horses and on small animals, I must say I've done trigger point therapy using needles on horses. It's a whole lot easier because also the muscles are a whole lot bigger and the trigger points are bigger. But on a small, like little Jack Russell that is just wiggling around, and as you put that little needle in, they get that like sharp pain, and then they jump. How effective is it if you're not actually staying for 3 to 5 seconds, if it's just sort of one prick that you get into that trigger point?
Yeah, you're still activating that local twitch response, right? So either which way, you are doing what you need to do. So basically, I explain it to clients that it's almost like a homing beacon. So the body knows that there's pain, but it has no idea where it's coming from or how to fix it. So what we're doing is we're creating a little homing beacon. So you get that needle in there and you create that one little twitch response, your results will be phenomenal. If you can do 3 to 5, great. If you can't, one's effective enough. And it's funny you say that, because honestly, throughout the last decade and a half of playing or doing this, it's really weird, because you go in there and yes, they're a little wiggly and they kind of look at you the first time you do it, and then they're completely relaxed. They're like, oh, okay, I get this. This is where it's been coming from. So even my most aggressive dogs, even my most wiggly dogs, and high energy dogs, I mean, I often lie on the ground with Labradors and do it, because, that's the easiest way to get them to be still. But they tolerate it phenomenally. Instinctively, they know that you're helping. And especially if you find that point and you don't mess around with it, you just kind of go in there, get it done, and you're out. They really do respond very well.
Yeah, I think especially for those wiggly dogs, maybe it's actually easier because, to try and do manual therapy on them, it takes a whole lot longer than just to quickly get a needle in. So sometimes those dogs that just get a little bit bored and restless, you just want to get in there and help them out and get out,
Absolutely. And, especially with those, you can't do acupuncture with them, because how are you going to keep needles in for 20 minutes? You'd be hunting them all over the room because they'd be running.
Yeah, you have. I mean, I've had loads of those cases where you're just struggling for that 20 minutes to try and entertain them with treats and, trying to get them just to try and sit still, or jumping up and shaking, and then you have needles flying all over the place. Exactly. Fabulous.
And that's the beauty about dry needling, is you really do one at a time. You don't leave the needles in. There's absolutely no need for it. Once you've got that twitch response, out you go. It's very safe. If you know how to do it properly, which is, the most important thing with any skill, is you need to know how to do it correctly and efficiently. But it's super quick. It's incredibly effective. And that's the thing is, we all at some level, doesn't matter where we are in the veterinary world, we're selling time. Yeah. And acupuncture, as effective as it is, and it's wonderful, and widely used now, it takes a long time. And we can get the same results if we're treating on a myofascial basis and on a kind of musculoskeletal basis. We can get the same results with myofascial dry needling in 1/10 of the time that you would get with acupuncture.
Yeah. And I'm just thinking, like, for vets that are just in regular practice, so not necessarily the rehab, obviously the rehab vets would be using this technique, but this is something that a GP vet could actually integrate into their practice. Absolutely. Because, I mean, they're seeing these cases, they don't have a lot of time. They're coming in for their general arthritis checkup and examination, and they could do some quick dry needling to sort out those trigger points. In a very quick space of time, in a normal consult.
Absolutely, like literally in a few minutes.
Yeah. Awesome.
And it's great. It really is. It's we've had amazing success with it. So absolutely.
So I always ask this question, like, is there any research behind it? Because obviously in our field, in the animal world, we're a little bit behind. So is there research in animals, or are we extrapolating from human research?
Definitely extrapolating from human research at the moment. Gratefully, a lot of the systems are very, very similar in a canine as it is in a human. And so we definitely do find that the same processes occur, both on a chemical basis as well as on a functional level. The biggest trouble is money and research and time. So it's not something that a pharmaceutical company can back, because it's the body healing itself. So in, like most things in animal medicine, if it's a manual technique or a tool, it's not really regarded very high on the research levels, because we don't get funding. So that's our biggest issue. But having said that, just from personal experience and being in the myofascial world, in the human world initially, it really correlates very strongly. So Travell and Simmons, there's constant research coming out. If you go into PubMed and you just Google dry needling, you'll get thousands and thousands and thousands of papers that have been peer-reviewed and published. And it's wonderful because we're understanding more and more the pathways and how intricate it really is, and how smart the body is by the way that it deals with different receptors and aggravates certain things and tonifies different things. And it's really, really fascinating. From when I went to school 20 years ago, oh my goodness, to now, more than 20 years ago, the research has changed significantly. And we had excellent research then, but it's just got better and better. The more that people are finding that really functional medicine is as important, if not more important, than structural stuff. So there's a lot of research coming out. So if you're interested in the mechanisms, and if you're like me and you want to geek out and all that stuff, PubMed is a fantastic resource for that.
Yeah. So, I mean, it's obvious how passionate you are about the subject. So it's not surprising that you decided to write a book on this topic. So tell us where the inspiration for the book came about.
Well, I've always worked very integratedly, and that's a very big passion of mine. I don't believe that anyone is an island, and that in order to be sustainable and to be a real contributor in an animal's life, we have to do integral medicine. And that's veterinary, vet nurse, chiropractor, physical therapist. We can all play in the same sandbox and be really good. And of course, then the patient benefits remarkably, as do the clients, because we're all kind of on the same page. And it's amazing how people react when they know they're being held by a team. Yeah. So one of the biggest things was I was finding in private practice that it was really expensive for people to go for acupuncture. Like I say, is wonderful, but you need to do a lot of it. And people were not really getting the results because they couldn't financially afford to do the follow-ups. And Megs, you know this from being in practice. They were like, well, I've got enough money for 3 treatments and that's all I can do. And you're like, holy cow, this is going to require 8 to 10. Yeah. So we kind of sit in this limbo period, and we have to take into account that, if it's going to be bread on the table or your dog's acupuncture treatment, it's a no-brainer for most people. And I think even now more so with COVID thing and people having lost so much money and things like that. So I was like, okay, I do this for people. I'm a sports physician. I know what I'm doing here. Why aren't we doing this in animals? So, that's where the whole thing started. And it just snowballed because it's something that is cheap. It's quick. We don't have to charge the earth for it. And it's incredibly effective. So I was like, we really need to do more about this because animals are losing out because we don't have the time, or the client doesn't have the finances to actually support this. So I took kind of 17 years of knowledge and I put it into a book so that I could teach all of you lovely people how to do this effectively and to be literally life-changing in your animal, in your client's world. And I mean, we've seen it where dogs completely non-ambulatory in a limb. He has 2 treatments with myofascial dry needling, literally takes 5 to 10 minutes, and he runs into your office the next day. And that's a game changer for everybody. And that's really where it all began. So I was lucky enough to be living in a state where it snows for 9 months of the year. So I was like, okay, what are we doing in winter? We're going to write a book. And I'm very excited to bring this to everybody because I think it's a real, really big missing link in the manual world as such. And if we can understand muscle more effectively, because we really don't, we think we do, we know actions and insertions and all of this stuff, but the muscle fiber itself and the fascial planes themselves, we don't really understand. We're only starting to look at them in integrated medicine now. And this is one of the reasons why the book was created. So yeah, that's my blurb.
So what is the name of the book? What is it called?
It's A Clinician's Guide to Myofascial Pain in the Canine Patient.
Okay, and it's available on pre-order now, right?
Yep, it's going to be released on the 15th of July. So that will be available on Amazon. And keep a lookout on my Facebook page and on my Instagram, which is Dr. Michele Broadhurst or Michele Broadhurst, because we will have like some discount codes and things like that for you guys. So yeah, but otherwise it's ready for pre-order, and I think it's already at a discounted rate. So just go and check it out.
Okay. For the listeners out there, we will put the link to purchase it on Amazon on pre-order. And if you're listening to this after the 15th of July, you'll just be able to go straight and order it there. So we'll put that in the description. So what can the readers expect from the book? So what exactly is in the book?
So we go through a multitude of different chapters. The first one for me, and I talk about this all the time, is palpation, 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 palpation. Because if you don't know what normal is, you won't know what abnormal is. So we go through the mechanisms of muscle, how it works, the functionality, how to identify normal, how to identify abnormal, and all those sorts of guides. Then we work through it like a diagnosis procedure on how to actually diagnose myofascial trigger points. We go through a variety of different modalities, as well as really concentrating on myofascial pain syndromes and demystifying it. Because I think for a lot of people, they start looking at it and they go, too much information, can't, it's just too much, it's too intense, it's too crazy, like I can't possibly understand exactly what's going on here. So we could try to take that myalgia and myofascial pain syndromes and demystify it a little bit so that people actually understand what they're treating, as opposed to just like, oh, there's a knob here, I'm going to do this. Like, that's not why you're doing it. If neurology and pain responses are not the core of what we're doing, we're really doing a poor job. So understanding the why is a big part of the book. And then we go into like local twitch responses, what they are, how they work, all that sort of thing, and then different mechanisms. So there's a big portion about dry needling. We talk about laser. We talk about extracorporeal shockwave, and mention a couple of other modalities, which are, like I say, as effective. They just may take a little bit longer. Especially if needles are not in your scope of practice, or it's something that you're not comfortable doing, because not everybody is, and that's absolutely fine. You've got to find what works in your wheelhouse. Talk a little bit about the differences between acupuncture and dry needling, more so you can educate your client as to the differences, because they are very different. And I can't count on my hands the number of times I've told my patients, like, this is what's going to happen, this is going to be the response, and they call and they go, the dog's way more sore than they were with acupuncture. I'm like, yeah, we went there. But it's really important so that you understand, especially if you're not an acupuncturist and you haven't been in that world, to really understand and be able to communicate with your client how different that is and what to expect from a treatment. So we go through that too. We talk about needle use and safety. We talk a little bit about legislation, and then we go into the muscles themselves. So understanding a muscle's relationship with the body is really important, because then we can understand where it is firing, where it's not firing, how it's dysfunctional, and change that dysfunction with whatever modality you choose. So with the muscle chapters, we really go forelimb and hind limb and then back. And I think I'm under correction, but I think we have almost 30 muscles covered in this book. And really we start with the basics: action, insertion, innervation, all our kind of good old favorites. And then we really concentrate on palpation, like actually being able to feel out that muscle. What are we looking for? How do we identify that thing? Where are those trigger points found, and where do they refer to? Because if you don't know where they refer to, you can't diagnose that necessarily very well. So understanding the referral patterns and going, okay, so I'm in this, this muscle, I'm in the hamstring, this is where it's referring to. Oh my goodness, it's going all the way down past, towards the hock. And we thought this dog had a hyperextension issue, but we're actually coming all the way up from the hamstring that's creating this lameness in the hock. So keep that in mind. So it's not always where we think it's going to be. And then we go through different treatment protocols. We talk about things that cause the trigger point, causative and perpetuating factors. We go through agonists and antagonists, which are really, 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 really important. And we don't give them enough credit, because when a muscle is not working optimally, what happens? Hopefully its friends come to the party to try to create a compensatory mechanism. So remembering those compensatory mechanisms, knowing where to look when we have a long-term issue, like we were talking about hip dysplasia, you always see those dogs with an atrophied glute med. So we need to remember which muscles may be overcompensating, look for trigger points there. All of a sudden that hip pain gets significantly better because we're treating the compensations. So I incorporate some stretches, some things like that too, and then needling technique for each muscle changes. So I have included needling technique for those of you that do want to needle. For the rest of you that would like to use a different mechanism, you know how to do that, and we would have covered that in the book already. So yeah.
Wow, it sounds very, very thorough. I'm really, really looking forward to seeing it. So one of the things I always say to the vet rehabbers is that you guys have all got a book in you, because everyone has knowledge, and the way in which we learn, and this is obviously the reason that I created Online Pet Health, is that we can learn from experts all over the world, come together teaching and just sharing our knowledge, because when we share our knowledge, we can teach others and we can all help animals by learning. So do you have any tips or advice for those vet rehabbers out there that are thinking about writing a book?
Write what you know about, write what you're passionate about. Because if you try to do something that you're not passionate about, the words just don't come. This book got knocked out so fast. I don't even know when I wrote it, to be honest. It was a labor of love. And write what you're passionate about, write what you're good at, write what you feel you want somebody else to know, because you know it works. Don't be scared. The reality is, and at the end of my book, I do say, this is just the beginning, because we know what we don't know. We don't know how to always get there, but this is just the beginning. And that's the whole thing, is just start. Just write about what you love, write about what you know, write about what's in your wheelhouse, because I can tell you, we are not all good at everything. We cannot be. And if you can help somebody improve, if they're willing to improve, that is an amazing gift. So be passionate about and don't overthink it. Everybody's got imposter syndrome, and it's ridiculous, because we cannot all be that person. And I, by no means, I would not stand up and say I am the top specialist about myofascial pain. I'm not, absolutely not. But I have a huge passion for it. I keep on learning, I keep on looking, and I know what I know, and I want to give that to you. And we all have that in us, whether it's about exercises, whether it's about a specific technique or a modality or whatever it may be. You find out a nutrigenomic is amazing and you want to talk about nutrigenomics and epigenetics and things like that. It doesn't matter. Just start writing and send it out to the community, and you'd be amazed at how receptive people are to learning, and you're going to attract those people who want to learn. So that's the most important thing.
Great advice. So I had a little bit of an inkling maybe that there was another book being planned when you said that this is just the beginning. Is there another book?
Yeah, so the equine book is coming out probably August, September this year. Okay. It's ready to go. I'm just formulating a few things around it, because there's going to be courses involved, which is very, very exciting. So the equine book is going to be released in the next couple of months too, which is a huge passion. And I know this is the small animal group, but honestly, in the equine world, I've treated thousands of horses with dry needling and thoroughbred stallions, and they go to sleep. They do amazingly well. And if you can just be brave enough to try this, it is amazing what you can achieve with your clients. So so the equine book is coming out, and we Northeast Seminars and Dr. Matt Brunke and myself are going to be producing a course on the canine side. So that is hopefully going to be launched in 2021, where we can teach you all the amazing tools on how to do this effectively and be really efficient and proficient in your practice with this. So if I can teach you everything that I've learned, good and bad, and what to avoid, I'm going to try to do that so that you never have to experience it. But yeah, it's very exciting, and I'm thrilled that the veterinary world is really sitting up and paying attention about this, because acupuncture, like I say, is wonderful, but it's an expensive course. It takes a long time, and this is a fantastic tool to and a very different mechanism too, that is very applicable in general practice or in your rehab practice.
Well, we're excited about all those courses coming in the future. And of course, those equine vet rehabbers, look out for the book. And you small animal vet rehabbers, you know where to go and place your order on Amazon. Post the link in the description, guys. Michele, thank you so much. That was really, really interesting, and I've learned loads.
Awesome. Thanks, Megan. You have a great day.
If you enjoyed listening to this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about veterinary rehabilitation. For more information about continuing education for vet rehab therapists that you can do online, you can go to onlinepethealth.com. I'd like to thank you for listening to this podcast, and of course thank our sponsors, Pulse Vet. We thank them for their commitment to their mission to improve the quality of life of the animals that we all love by developing, validating, and providing advanced shockwave therapy at the highest level of support and service. Remember, you can reach them at pulsevet.com or info@pulsevet.com. See you all next week.